So good morning all. Now we are going to see a case study of one condition in surgery topic. That means a 51-year-old male presented with a complaints of left lower limb swelling associated with redness of the skin, and the report showed D-dimer was elevated. How will you diagnose this patient? So this is the deep vein thrombosis case. Deep vein thrombosis means the veins in a lower limb get swollen. That means why it is swollen means the thrombosis, that means immovable blood clot is obstructed the blood flow in deep veins. This is called deep vein thrombosis. The deep vein thrombosis is the type of venous thrombosis involving the formation of a blood clot in a deep vein, most commonly in a legs or pelvis. The other name associated with the conditions may be thromboembolism, post-thrombotic syndrome, post-phlebitic syndrome. These are all the common names for the deep vein thrombosis. The etiological and risk factors or the main causes of deep vein thrombosis are damage to vein from surgery or inflammation, and damage due to infection or any other injuries. The risk factors are age, lack of movement, pregnancy, birth control pills, smoking, cancer, inflammation, bowel disease, genetics. These are all the risk factors. In this picture we can able to see the valves in a deep veins, and this is the blood clot. So this is the typical deep vein thrombosis. So the complications of deep vein thrombosis is pulmonary embolism, which means in vein, because of the calf muscle pressure, the thrombus the thrombus get break down and it turns to emboli. It can go throughout the circulation of blood, and it goes and reach the lung, and it gets obstructions. This is the pulmonary embolism, which means the first thing it start from near the heart. The second one, emboli travels throughout the veins, that means the aortic vein, and then it is a piece of blood from the break. It starts breakage. The emboli goes throughout the aortic vein and it goes to the heart. Embolus gets stuck in a blood vessels on the lung. So this is called the absolute pulmonary embolism. The post-phlebitic syndrome, damage to the vein from the blood clot reduced blood flow into the affected areas. The symptoms including leg pain, leg swelling, skin color changes, and skin sores. These are the main complications of deep vein thrombosis. And the clinical manifestations. First thing, blood flow to the heart and the lung. The venous gets clotted, so swelling, inflammation below the blockage site, because of there is the poor blood flow to the organ. The clinical manifestation is swelling of the lower limb, leg paining, cramping or soreness that often start in a calf muscles. Changes in skin color on a leg, such as red or purple, depending on the color of the skin. The feeling warmth, that means the if you palpating the lower limb, affected limb, it gets we can feel the warmth. There is some heart. And diagnosis of deep vein thrombosis: history collection, physical examination, D-dimer blood test. This test often can help rule out pulmonary embolism. Duplex ultrasound, venography. This test uses X-ray, and due to the dye create a picture of the vein in a leg and a feet. The dye is injected into the large vein into the feet or ankle, and then magnetic resonance imaging, that means MRI. This test may be done to diagnose DVT in the veins of the belly. So this is the D-dimer test from the affected site. And then we are moving to the treatment goals of the deep vein thrombosis: prevent the clot from the getting bigger, prevent the clot from breaking loose and travel into the lungs, reduce the changes of another DVT. The management filters, that means the filter is placed into the large veins, the vena cava in a belly. The vena cava filter prevents the clot breakage, loosen from the loading in the lungs, and supporting stockings, that means the compressing stockings like a varicose vein. These special knee stockings help to prevent blood from pooling into the legs. They help reduce leg swelling. Another one is compression stocking. The compression stocking, also called as the support stocking, press on a leg, improving blood flow, and stocking butler may help with putting on the stockings. Catheter releasing the medications, cloth, this is thrombolizing. Another procedure is angioplasty, that means catheter and balloon, it is inflated and breaking the clotting. Another one is inferior vena cava filter. This is emboli, the filter gets sucked out of the veins. The medical managements are anticoagulants and thrombolytics. Another procedure is thrombectomy. So this is the thrombectomy. That means in this procedure, make incision in a vein or artery above the clot to remove it, or they may insert a thin tube called catheter into the vein, into the groin or arm, and then thread it through blood vessel to reach the clot. Either way, they injected a contrast dye into the blood vessels to help pinpoint the clot location. The clot often is in a vein or artery in the arm or leg. Usually the clot must be very large to justify a thrombectomy. In some cases, they insert a special balloon attached to the catheter and inflate it to remove any remaining part of the clot, and permanently leave a different tube called stent in the blood vessels like this. Risk with the thrombectomy including excessive bleeding during procedure, damage to the blood vessels during surgery, infection, and a negative reaction to the anesthesia. So these are all the common procedures for the DVT, that is mechanical thrombectomy or suction thrombectomy or segmentary thrombectomy. Thank you.